Hey guys, it's Hina Sheth from Rebalance Physical Therapy here in Philadelphia and the main line of Pennsylvania. And today I want to talk to you about a patient that actually called me recently, worried because she is scheduled to have what's called a rectocele repair, or a repair for a prolapsed rectum. So what is that? So basically, many times after you've had children, okay, because of all the pushing and the straining that can happen during delivery and also just carrying the baby, your organs have a lot of pressure on them. And that pressure can create what's called looseness or laxity of the ligaments that hold these organs up, and they start to kind of fall into the vaginal or the rectal canal. And there's three different organs mainly that can be the culprit of what's called this prolapse, which is this falling out of the organs. One is the vagina can actually fall, the bladder can fall, and the rectal can fall. And they have all various medical terminologies, but basically just realize that, you know, any of these organs can start to descend or fall into the vaginal canal or the rectal canal, and it can cause pressure, it can cause discomfort, it can cause constipation or feeling like you have to move something out of the way because you can't have a sufficient bowel movement. And then it can just be cosmetically very uncomfortable because here there's something kind of falling out and there's pressure maybe in the vaginal or the rectal canal or even in the low back in an area called the sacrum, which is behind this bone right over here. Okay, so just imagine there's organs that can come down through the pelvis and they can basically fall down. So I basically had a woman that had called me, and she had went in and spoke to two different colorectal physicians, and they both recommended that she have surgery for this rectocele that she was experiencing. And make a long story short, you know, she basically, one of her friends that I was treating basically told her to come in and see me. And so we went ahead and, you know, evaluated her and found out there was a lot of things that she could be doing from an alignment standpoint, okay, as well as from a soft tissue standpoint and a strength standpoint to improve the support of the rectum and possibly not have surgery. So again, because she had come with the advice of, and actually she was scheduled to have surgery 2 days later, I was kind of hesitant to say, hey, this is all going to be okay with physical therapy, but let's wait and see, and maybe if you could just postpone the surgery for a little bit, let's see what we can do. So basically she ended up coming in, we evaluated her, we found a lot of different alignment issues, and we found a lot of soft tissue issues, both on the outside as well as internally. And soft tissue issues, what I mean by that is that a lot of muscle spasming, scar tissue from scars. She had had 3 different C-sections, and from an alignment standpoint that she wasn't in her optimal position from head to toe that allows adequate support and positioning of where the organs should be so that they're not falling out. So that's what we ended up working on, and within 3 visits, this lady's doing great. So we were able to prevent her from having surgery. Now, the one thing that I was very surprised by is that here we are in Philadelphia, we have lots of wonderful healthcare systems. We have lots of different wonderful, well-known physicians in this area. And so nowadays, when you do have a prolapse and it's you know, maybe mild to what's called moderate, then one of the first things that women should do is actually get a consultation from a pelvic floor physical therapist to get this conservatively treated first before jumping into surgery. Because surgery, as we all know, once you change something, it's really difficult to change it back. And that's what happens with surgery, okay? So this was a woman that came to me. We ended up fixing her, and actually she had a severe, what was considered a grade 3 rectal prolapse, and we were able to fix that. And I have a feeling between all the things that we gave her and some of the management strategies and a lot of the education between diet and movement and positioning and how she should be working out, I have a feeling she's going to be able to get by she's gonna have many, many years ahead of her where she'll be able to get by without having surgery. So again, for any of you out there that are diagnosed with a prolapse and you haven't been treated in a holistic, from an alignment, soft tissue, strength perspective manner to really get everything positioned right, then I strongly encourage you to find a integrated holistic pelvic floor physical therapist in your area to help you with this prior to you having surgery. And if that physical therapist is skilled enough and they feel that the prolapse is too significant, that this is out of the scope of physical therapy, then they will be skilled enough to let you know that, hey, this might be a little bit outside of the scope, and then you perhaps do need surgery or surgical intervention. All right, so I hope that was helpful to all of you out there. Have a wonderful day. If you need any information or you need help finding a physical therapist in your area, we have lots of different resources to help you find someone, and if we don't know someone in your area, then again, we can point you in the right direction. So you can come to our website. It's rebalancept.com. That's REBALANCEPT.com. And if you live in the Philadelphia area or on the main line of Philadelphia, then it's obvious you can come in and have an evaluation with us. Or again, send us an email and we'll help you find someone in your area. Take care. Have a wonderful day.